For my topic, I chose common sleeping disorders. Sleep is split into two categories, NREM and REM. It's where our circadian rhythm is controlled by a master clock in the suprachiasmatic nuclei of the hypothalamus. There are many disorders that I could go through, but I picked 3 of the most common and most heard of. The first one being insomnia, the second sleep apnea, and the third narcolepsy. Insomnia is one of the most common sleeping disorders that people struggle with. It could be a genetic, it could be just trouble sleeping. It is characterized by dissatisfaction with sleep, difficulty falling asleep, and staying asleep. It could affect people during the day with lack of energy throughout the day and low cognitive function, so you're typically very tired, you don't want to get much done, your focus is very slim. People with insomnia usually have more active cortex and struggle with memory, so anything new coming in isn't really converted into long-term. There are some new studies that show that it can affect mental health and cause depression and anxiety. Acute insomnia is also linked to life events, and if you change your sleep schedule up, for example, going from a high school from a college schedule could be very different with waking up times and going to bed. Some things that would influence insomnia are hyperarousability, anxiety-prone personality, family history, so genetics, and chronic illness. For example, if you take medication that would keep you up during the day and don't really help you wind down at night, that could also be a cause of the insomnia. And those with insomnia have an increased autonomic nervous system. Sleep apnea is characterized by the repetitive collapse of the pharyngeal airway. There is a negative pressure reflex that makes the muscle dilate, which will not work properly throughout the night. But if there is a buildup on the augmenting muscle, it will open up the airways. Arousal could also help sleep apnea, but is not a cure for it. There are 2 consequences of sleep apnea. One is neurocognitive dysfunction, and 2 is cardiovascular disease, which is a result of hypoxia. Some diagnoses and treatment for sleep apnea are loud snoring, if you are witnessed gasping throughout your sleep. Obesity, you will have a higher chance of having sleep apnea. If you sleep a lot throughout the day, and hypertension. People can participate in a sleep night study where they will give you a CPAP, and for 2 hours, in 2-hour increments, they'll have you sleep every 20 minutes. You can also do an at-home oximeter, a polysomnograph, and then once you are diagnosed, you can get a nasal CPAP, an oral appliance, or an upper airway surgery, which is very extreme cases. They would suggest that. The last one I'm going to talk about is narcolepsy, and it is a cause of chronic sleepiness and affects 1 in every 2,000 people. It can be diagnosed anywhere from 5 to 15 years old. Some people are much older than that when they are diagnosed. Type 1 is caused by an extensive loss of hypothalamic neurons, and type 2 is very similar, but the root of the cause is unknown. Sleepiness is severe and is hard to focus. You sleep a lot throughout the day, you barely sleep throughout the night. It is classified by the disordered regulation of REM, and cataplexy is a sudden episode of partial or complete paralysis, so the person will fall asleep not knowing and won't be able to move throughout that. Some diagnosis and treatments, it can be found in clinical history. You can get involved in a sleep latency test, where you are encouraged, again, to sleep every 20 minutes for 2 hours, or in 2-hour periods. There is a lot of daytime REM, so you will be in a deep sleep when these episodes do happen. And you can also get involved in a positive multiple sleep latency test. Some treatments, you can use behavioral and pharmacological, so wakefulness promoting medications. You can follow the Epworth sleepiness scale to see how much you are sleeping through these episodes. Norepinephrine and serotonin will reduce your need to go into the full REM cycle, and then sodium oxybate also reduces your need to go into the full REM cycle and is used very often because it does not have as many side effects as other medication that they would use. And there's my bibliography.